Okay, so we are recording the class tonight. Hopefully this will help all of you in case you need to refer back to anything we said in here. And it's also and primarily for the online students. That way they can follow along, they can be a part of the conversation even though they're not physically here. You may not be able to see the PowerPoint on the video. It may be inverted or it may even be too far away, but you do have the PowerPoints online, so you can follow that along. The important part is not so much the PowerPoint, more the conversation. So if you ask questions in here in the class, I'll probably repeat it a little bit closer to the computer so that way the online students know the questions asked. And if it's, I don't know, a few questions or an ongoing conversation, I'll just ask you to please speak a little bit louder so that way, again, it's recorded. It cannot see, the camera is not pointed towards any of you. It's only pointed towards me in the PowerPoint. So no need to worry about that. Any questions before we start? Okay. So how is everyone doing with their reflection papers, going to AA or NA meetings or recovery celebration meetings?
I have a question.
Yes.
Is that okay? Because I've been to Celebrate Recovery and I've been to an AA group last week, this week. And I was wondering if I could repeat either one of, not in the same place, but an AA in another place.
So you've been to a Celebrate Recovery place, yeah, and an AA place?
An AA place.
Okay, yeah, you can definitely go back to either one of those places, okay, because you're not sitting in on, the same time frame or the same exact meeting. So you can go to the same location 3 times. Okay. You can go to 3 different locations if you want. It's just as long as you go to 3 separate different groups.
Because I really want to go to a outcome or
okay,
happen, but I don't know if I'm going to be able,
okay,
schedule and the place.
Yeah, so they can be 3 AA groups at the same location. They can be 3 Celebrate Recovery groups at the same location. It can be 3 NA groups at the same location. As you'll find out, a lot of these places have multiple meetings even in a day. So hopefully that helps you with your schedule. If you haven't been able to find one yet, has anyone had trouble trying to find a meeting?
I found some, but I just found out that she told me, just walk in there. Instead of waiting to hear from them, just walk in there.
Yeah.
So that's what I'm going to do because they're going to have one Friday. So I'm just going to walk in there so I can go ahead and get my classes.
Yeah, there you go. Yeah, if you had any trouble, you can always just Google literally AA meetings in my area. You'll find plenty, even in Deerfield Beach, even in around here. But nationwide, I mean, you'll find AA groups even in the most remote locations. I remember having clients who lived literally in mountains, and they were able to find AA meetings, sometimes even within biking distance, because they didn't have cars, because of the substance use, because of legal issues, and they're still able to find them even in the Appalachian Mountains, literally in the mountains in the middle of nowhere.
I think that's why I went to one. This is the one that I went this week.
Yeah.
I got there and I said I didn't see much cars, maybe 2 or 3 cars. I said, oh my God, it might be really empty. And when I got in there, it was like almost 100 people.
100 people. Wow. Yes. Yep.
That's amazing.
Yep.
All the people go, right?
Yeah. Oh yeah. And actually, we're going to be talking about that tonight. So we're going over Chapter 10, Group Therapy, because that was the reading assignment for this week. But we're also going to be going over Chapter 12. Now, you don't have to read Chapter 12. I'm only presenting Chapter 12 because it's actually about the 12-step process. What you'll be hearing a lot about in these meetings, what you'll hear a lot about probably in this field if you choose to go into substance abuse, is 12 steps. Like, what does that mean? What does that look like? 12 steps exactly is really common. I figure since I'm requiring you to write 3 reflection papers on the process, I'm not going to require you to read the chapter, but I still want to present on it. That way, if you have any questions being at meetings already, or if you had questions in the future going to these meetings, this will hopefully make that a little bit clear. Okay, all right, so let's start with group therapy for treatment of addictions. All right, so group therapy for multiple addictions. Group counseling, most common treatment, 94% of treatment facilities use group therapy. It's low cost to usually whoever goes because there are so many people. Instead of paying $60 an hour or $100 for an hour individual session, you can cut that in half or even get it as low as 20, 30 bucks effort for a group. Again, really benefiting from hearing other people as well as a therapist. And common functions of group, you have education, therapy, support. A lot of times in treatment facilities, group therapy consists about probably the majority of the therapy you get. So family therapy and individual therapy is pretty common, but then pretty much everything else you get is group therapy. Group therapy could also include AA meetings or NA meetings. Group therapy is when you're just meeting with other individuals who struggle with addiction. It can be psychoeducational groups, which was what we'll get to in a little bit tonight. But again, really, really common. 94% of treatment facilities use group therapy. Okay, so theory behind group work, sense of universality, I'm not alone, empathy and support, interpersonal learning, group cohesiveness, preventative and remedial. So sense of universality is really important. I'm not alone. It's really helpful to hear and a lot of different cases that the consequences caught up with them, right? The consequences of using substances caught up with them in a really negative way. You'll hear this a lot in the groups and AA meetings or NA meetings, Celebrate Recovery meetings, which in some ways is helpful because you realize then you're not alone. And that rolls into empathy and support. You're able to put yourself in someone else's shoes. They're able to do likewise. They can reciprocate that. They can offer support. It's a lot of learning among the members and looking at the dynamics. You'll learn in group therapy class, if you haven't had it yet, they represent a microcosm of society. Does anybody know what that means?
Yeah, they represent a particular group in society that's fond of using.
Okay.
Statistically, it's like doing statistics. You take a portion of society, you survey them, and then you generate numbers from how many people you surveyed, and then give a percentage.
That's exactly it. That's exactly it. So it's really similar to a sample. You almost have like a sample world in that group. You have a lot of different personalities. They even say, even with 10 people in a group, you're going to have a pretty similar situation that you would have out in the real world. So it's almost like a microcosm, like a small little world where you can test, you can practice, you can talk, you can empathize, you can learn from that group. If you're not getting along with someone, or if you are getting along with someone, why? Why do you get along better with this person than that person? Why do you have this conflict with maybe these certain individuals versus the other ones? And since it's in a therapeutic setting, whereas you wouldn't normally be able to ask some really important questions, you do have the opportunity to learn, ask important questions, why that is the case, trying to understand behind the scenes, learning about why someone interprets you the way they do, why you interpret someone else the way you do. Really, really important. And that really ultimately is the goal of group cohesiveness. You want to be able to connect, communicate, and really learn from each other and group work. So it's preventative and remedial as well.
You know what I found?
Yeah.
Just what you were saying, how you portray a person. I find that that's a battle to not portray a person in my personal life. I deal with people on general standards, but that doesn't have anything to do with how I portray them. And I found out that when I found that there was a difference, now I'm struggling with trying not to portray them because I don't really know them. So it's still hard. Because the way the person acts.
Okay, so when you say you try not to portray them, what do you mean?
Let's say for instance, there's a young lady that just acts a certain way.
Okay.
Automatically, I want to just get, and I'm just speaking hypothetically, this is not the real way I feel.
Okay.
But automatically, I just want to say, oh, forget her,
Mm-hmm.
you know.
Right.
But on the other hand, my sister just said she got to be responding that way for some reason. So I'm trying not to, because if I portray her a certain way, I know that that'll keep me from being beneficial in the area where she probably may need it.
Okay. That makes a lot of sense. And it's interesting because you'll find this with a lot of different people. I know I found it with myself when first starting group work, when first starting to facilitate group work. You learn a lot about yourself, even in a group setting. You would think, oh, if I really want to work on myself, I should go strictly and only with individual therapy. But has anyone been in a situation where someone acts different in a group versus when they're alone? And it's almost like two different people, they act completely different with a group of people versus when it's just you and them. I know that's been really, really common, at least for me. It's been very common for even a lot of clients. It's really interesting to see the dynamic of how they interact with just you when it's an individual session as a therapist versus how they interact with other clients when it's in a group setting, right? When there's a client with 9 others and you, it's a different dynamic and you get to see a different part of the person. You're able to see a different side of the person that maybe you didn't see before when it was just individual therapy. So again, that's what is really, really helpful with group therapy. It kind of goes back to the theoretical aspect of why it is also really helpful for empathy, learning, etc.
Do you have any study regarding this? Because that almost crossed my mind regarding the riots that we have in soccer games. The group, they do things that an individual would never done alone.
Yeah.
So
Oh yeah.
you generally see, oh, he's such a good boy. But when he's in that group, in that situation, he kills another person. He beats another person. And is there any study why this different behavior in a group and in the individual?
Yeah, there's a lot of research behind it, actually. There's a lot of research that you go in depth in the class called group therapy. We actually dedicate a whole class to group therapy because of how much research has been done, how impactful it is to your client, how much you can learn from it. And it's really, as we mentioned, 94% of therapy modalities in a lot of treatment facilities. It's a really, really common modality to use because it has such a big impact. As you mentioned, you can even see that in sports, you can see that in the fans, you can see that in politics, you can see that in even how we describe people in groups called groupthink, how a group tends to think is really, really interesting. There is a lot of research behind it. We don't go into that much depth here, but just so you know, there is a lot in that class if you haven't had it yet. I think it's actually required. It's part of the core curriculum. And it might be an elective as well, but I think it is core curriculum. I think it's part of the core.
Is it the, I think it's group counseling.
Yeah, group
Yeah,
counseling.
we took it out earlier summer.
Okay, yeah. At some point, you should run across it, and that's where you get a little bit more in depth.
It's a requirement for the course.
Yeah.
So if you're doing either clinical counseling or marital counseling, it's a requirement.
Okay.
You're gonna take it.
So, benefits of group treatment of addiction, it breaks down denial. How do you think it breaks down denial, being in a group? How does that make sense? Anybody want to guess?
Because there are other people, sorry,
It's going the same thing.
Yeah,
They
but
feel
it's-
comfortable to say,
it's going through the same situation.
Okay,
Make
Why?
them feel comfortable, yeah.
And you
okay.
can identify yourself in the situation of the other, and then you can recognize, wow, I'm getting through that, and he is agreeing that he has a problem, so why I don't?
Okay, so because you can identify with the other person and their experience, it's a little bit easier to call them out maybe, say, hey, listen, you're maybe not telling the truth. Why is it different when a therapist would call out a client in denial versus another peer calling out that same client?
Because the person that's being called out by the therapist doesn't think or feel that the therapist can empathize or sympathize with them.
Okay, that could be a
As opposed to
reason.
the person who's in the group who has the same experience and they can sit there and go, well, yeah, yeah.
Okay.
You're right, so.
So one factor could be that maybe the peer's more empathetic, could relate a little bit more to the client, so it has a little bit more say.
Proud.
Say again?
Proud.
Proud, okay.
I will not fail to agree to you that I have a problem. But when I see that others have a problem too, so I can cope. I can,
Okay,
yeah.
okay.
I don't fail, but when I fail together with others, so it's less failure.
I also think
That
they
makes
can
sense.
see the signs of the symptoms and everything. Because if they've been through it, you can kind of recognize in another person, and you're not so hesitant to say, yeah, okay, this is me, because the person knows, whether because they've been through it together, but they've been through the same situation.
Yeah, and that makes a lot of sense. So think about the role of the group member who's calling out the client's denial versus your role in the group as the therapist, the facilitator of the group. There's pros and cons to each, right? There's pros and cons to being the therapist of the group. There's pros and cons to being a member of the group. One of the pros of being a member of the group is that you may be able to get away with a little bit more than a therapist would. For example, if the peer who has been really empathetic, who has been able to relate to a lot of their peers in the group, catches someone lying or in denial in some way, can maybe push a little bit more or may be able to connect with the person in just a different way, unlike the therapist could. Even a very empathetic counselor, even a very empathetic therapist could connect with a client, but it's in a different way, right? Because just by being in the therapist chair and then the rest of the group members being in the group members chair already signifies a hierarchy, right? There's already this impression, just because you all are sitting and I'm standing, I'm the one leading the conversation, there's already this implicit hierarchy that, hey, that person is in charge, we all follow. And because of that dynamic, when someone is more relatable on the same level, you're able to understand maybe where they're coming from a little bit more. You may be more inclined to hear what the other person is telling you. And that's really common. Really, really common groups. I've actually been in several groups where group members have actually worked together to help the client realize their denial in a really positive way still. They didn't basically curse out the client or beat him down saying, listen, you're in denial and you need to tell the truth now. But because very similar to that type of mentality at a soccer game with fans, groups do have an impact. And when you have maybe 2 or 3 or maybe even 6 of your peers who you were relating to for a very long time, who related to you for a very long time, who you've really cultivated a connection, now are confronting you, are now holding you accountable versus just one person, the therapist. And these people are people who you feel on the same level versus someone who's in authority. So it's really, groups are really, really powerful and can be really, really effective. So it's an opportunity to interact with others, promote social skills, promote self-disclosure, assist one another, confront offenses, blind spots. Peer influence enhances commitment to recovery. So again, really going back to that encouraging feeling, knowing you're not alone. When you realize you're not alone, even in your struggles, it's comforting. So when you realize you're not alone in your successes, it's that much more exciting. Does anybody know what blind spots mean? When I say blind spots here, assist one another, confronting defenses, blind spots.
Areas that you're not aware of.
Okay, areas you're not aware of. Exactly it. Think of a car. A blind spot in a car
Yeah,
is
there's
when you
one.
can't see. But if I'm on the car behind you, am I able to see that blind spot? Am I able to see what you can't see because I'm in a different position? Yeah, right? So if I'm driving behind you, I can see the car left of you, even though you can't because it's at such an angle that it's in your blind spot. The same is very true for groups, right? Of really being able to help the client understand there's a blind spot. I'll give you an example. So we all have blind spots. This is very common. It's very typical. It's part of human nature. And It was, gosh, I don't remember what year, sometime in college, in undergraduate school, I was taking a speech class. The speech class included like 50 or 60 people. It was in a very large hall. And it was basically where you had those stadium seats and lots of people. Great environment for a speech class, especially when you don't really like speaking in front of a lot of people. Well, I actually had to speak. Everyone rotated. Everyone ended up speaking 3 times throughout the semester, and you had to give like a 5-minute speech, 7-minute speech, and a 10-minute speech, right? And so when I went the first time, one of my buddies, who I was really close with, mentioned after I gave the first presentation that I kept doing this with my hand. And I was like on the side of my leg, just basically rubbing my fingers together. And I thought he was kidding because we joked around a lot. We like to give each other a hard time. He knew I did not like to speak in front of a lot of people. And he said, no, seriously, yeah, you were rubbing your hands. What's up with that, man? And I was like, oh, yeah, okay, man, sure, okay. And I was like, weird. I was like, no, that's weird. He's like, no, like, can we? I brushed it off, basically saying I really didn't believe him. I thought he was just kidding around, trying to make a joke. And then I had to present a second time. And this time was a little bit longer. And this time I actually remember making eye contact with him. Wrong choice. Still never do that, especially never do that. And he literally was doing this in the back of the class. And I was just like, take a deep breath, make sure I don't call him out, make sure I don't kill this kid. And I was just like, wait, and I didn't even recognize that. I looked down at my hands and was like, okay, my friend is just giving me a hard time. At that point, I thought for sure he is just giving me a really, really tough time. So third time, which is the last time I had to speak in the class, guess what my friend decided to do to prove his point, because I kept arguing with him after all that.
He
He recorded me.
Oh,
Exactly.
And he caught you.
He caught me. So he recorded me, and I literally was doing it probably for the whole time, for the entire speech. I mean, it wasn't too noticeable. I wasn't like saying, "Hey, everybody." I mean, it was just like on the side of my leg. And I was like, "Oh my gosh!" I was like, "He's right."
Oh my God.
And so that is a really good example of a blind spot, right? I mean, how embarrassing to sit in front of or stand in front of 50 or 60 people 3 times on 3 separate occasions, of rubbing my fingers together for the entire or nearly the entire presentation. So that is a blind spot, and it actually came to my attention because of my friend, right? Because someone outside of me who was in a different position saw a blind spot, saw something that I didn't see. So this happens a lot. This happens all the time. It actually overlaps with denial, right? You could have said, and I pretty much was. I tried to examine the evidence. I tried to catch myself or notice myself at points during the speech to see if I was doing it, but all times I checked, I was fine. I wasn't doing it. So that could have been denial, right? And if my friend literally didn't record me, I probably would still be in denial. I'd probably still be doing it to this day, even in speaking in front of classes. So it's really, really helpful to have those group settings to really help uncover those blind spots, because again, while they can be really embarrassing and really difficult at times, they're really, really helpful in the long run. You'll find this a lot in family therapy. Whenever there's just more than one person, even in couples therapy, blind spots is a great teaching tool to first teach, to maybe give examples like I'm giving you, to help them understand, normalize the process, realize everyone does have these, which is true. And it's just a matter of being open to them. So that is some of the benefit of being in a group. Purpose of group. So we have remedial or preventative, increased knowledge of self and others. So as we were just talking about, increasing self-awareness, increasing maybe your understanding of what some of your blind spots might be, even as a therapist, even as a counselor. Help clarify changes desired, provide tools, experiment with new behaviors, and safe setting, receive feedback. Okay, so let's start with experiment with new behaviors in a safe setting. What would that look like? Experiment new behaviors in a safe setting.
You mean in reference to the blind spots?
It could be with that. What would that look like? If we're using the same example actually of me rubbing my hand, I didn't realize I was doing that when I'm speaking in front of people. I finally looked at the recording. I say, okay, that is definitely embarrassing, but I want to change it. What would changing that behavior look like? How would I practice a new behavior in a safe setting?
I could ask,
You can hold something
Become
like
conscious.
this stand. You can stay with the both hands on top.
Oh, okay.
Or turn pages, something like that.
Yes.
first practice.
Okay.
Because it has to be a safe setting. You don't want to do this like in the middle of somewhere.
Look at your friend.
So what makes it safe?
Um,
Should I still include my friend who's giving me a hard time about it?
I think so, because he's your friend.
I don't know if I feel very safe with that answer. No, but that's very true, right? So you guys are hitting it all on the head, which is really good. We want to practice. We can role play. We can provide helpful hints, tools, tips, and say, hey, you know what? Why don't you speak with us? Speak in front of this group of 5 or 10 people for 2 or 3 minutes. Come next week with a prepared topic, and we promise not to make fun of you, right? It's a safe setting. We will provide positive feedback. Has anyone heard of the term constructive feedback?
Yep.
So a lot of times you hear constructive feedback, and I actually blame it on American Idol because that was actually one of the phrases they used a lot, or Simon in particular would give constructive feedback, and it was a little bit more destructive feedback. Of saying that you suck, and you just need to be a better person, you need to be a better human being because I don't know, even though you have a good voice, you just suck. It's like, wow, that's not really constructive feedback. So, yeah, unfortunately, the term constructive feedback, while well-intended, has a lot of negative connotation attached to it. So, I've actually used the term in therapy facilitative feedback, right? So, we want to provide feedback that's going to facilitate change, that's going to be a little bit more positive, right, than maybe the traditional term constructive feedback. And there are ways and tools to really use to follow a feedback that can be supportive, that lowers defenses. Because remember, I can be really defensive even in role playing with all of you. Even though I connect with all of you, you can relate to me, I can relate to you. We've been maybe in a group setting for a couple of months now. This is a really vulnerable area, and I'm making myself very vulnerable to all of you. So even if your feedback is well intended, if it's maybe phrased in a certain way, it can trigger me, it can raise my defenses, I can get really upset with you, I can take it really personally, and then basically be close to behavioral change. We don't want that. Again, that's a little bit more into your what we call counseling skills of how to approach topics, showing positive regard, maintaining that positive rapport, while still facilitating behavioral change. It's a skill, it's a tool. Has anyone heard of the sandwich approach? That's one very simple technique to use, but there's a lot more to it. It's called the sandwich technique because you have a sandwich, right? You have 3 basically components to a sandwich. You have the first layer of bread, the meat, or whatever's going to be in your sandwich, and then the second layer of bread, right? So the first layer of bread, you want it to be positive. So you say something positive, say, oh, I really enjoyed your speech, or I really liked your topic, or I thought you did a really good job articulating all your words. Then it comes the facilitative feedback part where, hey, at times you did this, maybe you can learn to do this or that. And then sandwich it with that last layer of bread saying, but at the end of the day, I thought you did a great job. I thought that you did a lot better than anyone ever expected. Please continue to work on this. I really enjoy it, etc. So again, it's that sandwich approach, one simple technique to facilitate a safe setting, especially when providing feedback. So, psychoeducational groups are very common. Educating members, foster self-understanding. So again, we're talking about blind spots. Blind spots can be psychoeducational groups. Coping skills is an educational skill. When we talk about deep breathing, there are certain ways to breathe deeply that can be more beneficial than just regular breathing, right? We talk about distress tolerance skills. We can talk about emotional regulation skills. We have a lot of coping skills out there as therapists. And a part of a group could be to educate all the clients about what those skills can look like, what those coping skills can look like when triggered. Provides experiential learning. So again, you can even, as we just mentioned, role play in group settings. That's a part of education. You provide discussion of the learned material, so information about addiction, communication skills, assertiveness, social skills. Again, one of the reasons why groups is one of the main modalities, 94% is used in treatment centers, is precisely because of the psychoeducational component. There's a lot to learn, right? When we meet a client, they're not going to know what emotional regulation skills. They're not even going to understand what a distress tolerance skill is. They're not going to understand what you mean by deep breathing because they're breathing right now. They're not going to understand what blind spots are. They're not going to understand what even an AA group means. So it's really going to be a big part of recovery to educate the clients. A big part of groups is to educate everyone about what a lot of these terms used in therapy mean for them. Does that make sense? Yes.
There is a part here that they say that a paraprofessional training in treatment of drugs. What kind of professional is this?
Say that again. What was it?
Paraprofessional, because the leader of the psychoeducational group can be a professional counselor or paraprofessionals trained in the treatment of addiction.
Yes. So a paraprofessional would be very similar to an intern.
Like a paralegal.
Yeah, in some ways. So you'll have substance abuse.
I can be a paraprofessional?
You can be a paraprofessional when you graduate. You can be a paraprofessional when you, perhaps instead of going the master's route, want to just obtain a certification. There's a certified substance abuse treatment provider, and they call it CSTP, where at that point you are considered paraprofessional. You're not a licensed mental health counselor because you're not required to take a licensure exam. You have a certificate where you're an assistant or you facilitate groups. A lot of times interns facilitate groups. A lot of times anyone with the certification facilitate group. The limitation is basically in individual therapy because you have to have either supervision from a licensed therapist or you have to be a licensed therapist yourself.
Oh, that's good.
Yeah. So psychotherapeutic groups helps with insight for dually diagnosed patients, explore pertinent life issues, family of origin issues, painful emotions, shame-based issues, grief. So again, even though it's in a group setting, you can take the group in a really vulnerable direction. It can be really beneficial, but it takes skill. It takes time. It takes practice. So I don't recommend it right away. But as you can maybe even see in some of these groups you attend, AA groups, NA groups, Celebrate Recovery, that a lot of these people who attend these groups consistently are very close. They're very vulnerable. They're very open. They're very emotional, to say the least, depending on the topic. A lot of the groups will have topics for certain days, so it really depends on when you go. But more often than not, a lot of these issues will arise. Family of origin, painful emotions, shame-based issues, grief, and helps with insight for dually diagnosed patients. Does anybody know what that means, dually diagnosed patients?
So if they have more than one issue?
Yeah, more than one diagnosis, right? So I think the statistic is 60 or 70% of individuals who struggle with addiction will have some other dual diagnosis. Will have either an anxiety disorder, or depression, major depressive disorder, or some type of personality disorder. Really, really common, and that's where groups can come into play. Hey, you know what? I not only struggle with addiction, I struggle with anxiety. Here's actually how it helps. Here's actually how it relates to my addiction. Do I have an addiction because of my anxiety? Did I use substance to try and self-medicate because I had so much anxiety? Or did I become anxious because of my addiction? Did I become anxious about where my life is heading because I got hooked on substances? So again, it's really important to understand the relationship. It's really helpful to hear from other people. Again, knowing you're not alone can be really therapeutic in and of itself. So group settings can be really powerful. Effectiveness of groups, structured psychoeducational groups show better outcomes. That's very true. It's really tempting, speaking from personal experience, to not always have a structured psychoeducational group. You will realize this field is very demanding. Groups can be very demanding. And because your schedule can be so tight-packed with individual sessions, family sessions, you're documenting notes, you're going to meetings, you're trying to make sure you're getting in touch with maybe your treatment team to not really prepare for groups, to just go off of a whim and say, you know what, I'm going to let them lead the group, or we're just going to watch a movie, or we're just going to have arts and just color for fun, right? Just to make time pass. Unfortunately, that doesn't really lead to effective groups. It is really helpful when you do prepare for groups because they can lead to really, really successful outcomes. It's really important. It is overlooked oftentimes because there can be so many groups at a treatment facility. What's just one that's unstructured? What's just one that we just let slip by and don't really prepare? So little empirical evidence that preventative psychoeducational groups are effective like DARE. The limited evidence group psychotherapy effective with addiction. So treatment success more likely with greater proportion group to individual counseling. Addiction clients in group counseling improve depression, trauma symptoms, suicide risk. So again, we're just really looking at the effectiveness of groups for a lot of different reasons, some of which we've already mentioned. For example, the empathy, feeling that they can relate more because there are more people to relate to regarding addiction is a big part. I do want to mention that as effective as groups can be, they can also be as hurtful. As much as they can be helpful, they can really hurt clients if it's not led or facilitated in a really careful way. That's where we as counselors want to use our training.
Did you have experience with groups?
Oh yes, all the time. I think I have more experience with groups than individual counseling.
Really?
Yeah.
What happens when one person of the group relapses?
A lot happens. It depends on the group. It depends on the individuals in the group. That's one of the pros and cons of a group. You don't really know. Some can be triggered by it. Some can be really hurt by it. Others can not care less and not really matter and say, okay.
It doesn't make the others relapse, or
it could.
It's strong. Make the others make the person strong. I was thinking about that.
I've seen it go in a lot of directions. I've seen it go in basically all those directions you mentioned. I've seen when someone has relapsed in the group and no one else has, as far as we know, relapsed in the group, say, hey, listen, I've also relapsed. I just didn't tell anyone. I've also been in groups where groups were very supportive and saying, okay, well, thank you for telling us. No one was very triggered by it as far as what they mentioned at least, and offered feedback, offered more resources outside of therapy. I've been in situations where other clients get very, very upset. I mean, you name it, you got it. At the end of the day, as a facilitator, what do you do when that happens? Okay, continue your group. So you're not shutting it down. So how do you continue? What do you do? What do you
explain
say?
to them what the situation is in a very tactful way, so that way they have a broad understanding of what's going on.
Okay.
So it's not impactful to the group in a negative aspect. And then what you do is you can do one of two things. You can either use that as a topic and try and tackle in other words, you want people to kind of self-identify with that relapse and go, could this happen to you? Which I've seen happen in a group, and it works in a positive aspect.
Mm-hmm.
So most people will, it's a topic within the group, and the group starts to touch on the relapse, which makes them more aware that they could possibly relapse. So
But it could
that
also
helps.
put the-
That helps a lot of people in groups.
I agree with Lee, because the person can use the problem as a topic and use it in a positive way to others, so the other people not relapse, will not happen the same thing to the other people. I've been participating in a bipolar depression group. It has nothing to do with alcohol, but some of them, they drank, and there were like 3 suicidal there, people, and they came out of the group another person. They came in with suicide thoughts, and they came out thinking about living life
Okay.
to the fullest.
Well, I went to one in Titusville.
Mm-hmm.
And the guy, he was very, I'm using not the right word, but he was very forward, but he was very smart. Very smart. But he didn't stay that long. Everybody else stayed there, but he was very open and everything, but you could tell he was like going through the motion. He needed a fix. And he eventually just left. But everybody stayed. That was an experience for me that I had never experienced before.
Yeah.
And they just up and leave like that. I never knew that. They just up and leave.
But it's also possible, you know, this is definitely what she mentioned and Oliver just mentioned is definitely a good thing, good outcome. But it's also possible that the person will be put on the spot, you know, and that they will, like the person who relapsed, and they won't, you know.
So let's say that happens. Let's say the person feels pressure on the spot after sharing that they've relapsed. They leave the group abruptly, and everyone else is still there. The conversation goes in the direction of glorifying drugs or reminiscing about their drug use, or, oh, well, you know, he thinks he relapsed. I relapsed 5 years ago, and instead of having 5 shots of whatever heroin, I had 10 shots of heroin. Or I OD'd 4 times instead of 2 times.
Conversation.
Yes.
Okay, and then what do
Okay.
you do after you relapse?
So
What
let's say
happened? What
you
were the
try to
consequences?
redirect it 4 or 5 times, and now it's going still, if anything, much stronger now in that direction. 20 minutes have passed. What do you do?
So as a facilitator, you have to draw a line.
Okay, how do you draw the line?
You have to redirect that conversation in a more stern way of saying, listen, we need to start talking about what is it that we're doing here as opposed to you relapsing. You're not here because you relapsed, you're here because you're trying to get yourself better.
Okay.
So try to bring it back to that conversation so they start talking about the positive. So we go back into cognitive behavior therapy.
Okay. Is it ever appropriate to end the group prematurely?
No, I think that's the worst thing that a therapist can do for their group. Is
Okay.
to stop the group in
Unless
general.
it's harming or it's gonna hurt somebody, you know, unless the group is in danger. And otherwise, you just reread the norms of the group and go on, you know?
There are so many ways groups can go. And the reason why I ask all these questions is because groups are dynamic, right? And there are times where groups have ended. There are times where people have walked out of groups. There are times where all of these situations have happened. And the great part about groups is because they are so dynamic, you can take a lot of different approaches. You can learn a lot about other people as well as yourself. I think you learn most about yourself as a therapist in a group setting. You get to gauge your level of confidence. You get to gauge the different type of assertiveness skills you can use because it is really difficult at times. The great part is you don't go unprepared, right? You have a lot of preparation beforehand with school, right? We have a whole course dedicated to group counseling. We're talking about it here, even though it's substance abuse counseling. You have your supervisors, you have your other coworkers, you have so many hours and hours and hours of internship because of this very reason, right? These conversations can go in so many different directions. All right, so great variety of programs, self-help groups, no charge. Most prominent are based on 12-step model, which is what we're going to be talking about later tonight. You have AA, which stands for Alcoholics Anonymous, NA, Narcotics Anonymous. Does anybody know what CA? Okay, good. GA? Good. So include process addictions, and then you have ACOA.
Adult children of addiction.
Good, and
Al-Anon is another
So people have family with
Alcoholics
addiction.
Anonymous type.
yeah, it's actually for the families, for the almost like codependency. If they struggle with codependency or enabling, those are groups for them. So SMART recovery is cognitive behavioral, share experiences, social support, give and receive help. Ethical and legal issues with group. Thoroughly understand the code of ethics and standards of practice, as well as state and federal laws, competence of counselor, screening of participants, informed consent, confidentiality, voluntary versus involuntary participation, group conflict. So we've hit a few of these already. Let's go with one of the examples mentioned about suicide. Where do you think the ethical and legal issues lie with suicide? If someone says in a group setting, hey, I want to end my life after this group, what do you do? What do you say?
It depends on age. If they are a minor
Okay, let's say
Then you
everyone's
have- then you
over
have-
18. We'll just leave, yeah.
Well, if you have over 18, you can counsel them. As far
Okay.
as liability to the counselor or due diligence to the counselor, there's really none because there has to be consent.
But you have
Because
to-
they are
I
adults.
think individual therapy would be.
Agreed. But I mean,
Okay.
if we're going into the code of ethics and standards, if
Okay,
they are adults, unless they have a plan of action, there's really nothing you can do. Unless they sit there and go, well, listen, tomorrow night I'm gonna go turn my car on and put a hose in my window, now that's different because now you have a plan of action. So now you can call the police department and say, hey, listen, they have a plan. This is what's going
Okay.
to happen.
okay,
So they end up getting Baker Acted at that point.
okay,
If they don't have a plan of action, but they mention it, and they go, oh, I'm thinking about it, there's not really anything you can do. When you start going into the minors, unless they're going to cause harm to somebody else.
okay. So let's go with that distinction because that's really good. If they have a plan of action, then that means they're really seriously thinking about taking that next step. So let's say I don't even go that detailed, and in the group, say that I want my life, the therapist says, okay, well, maybe we should look at individual counseling, we'll talk after. The gentleman says, okay, that's fine, but I'm going to end my life probably right after that conversation. Like by the end of tonight, I will be gone. No more detail than that. What do you do? Next step.
He has a plan, I'll go with.
Ask does he have a plan? Good. What else? What's
I'll
that?
stay with you tonight.
I'll say.
You're going to sleep.
Well, that's not. I don't know if your family will be very happy with that part, but that is well intentioned, so that's good. So, ask plan of action. No plan of action. I don't know anything specific. I just know it's going to happen. Then what?
There's still a plan of action because they're determined to do it within a particular time frame.
Mm-hmm.
So with that, there's still enough there to be able to call the authorities
Yes.
and have them committed.
Okay, when is it enough to have them committed or call the police? When do you call the police?
And you say, hey, I'm not gonna be here tonight. That's it, it's done.
Okay, so let's say you call the police on me. I am your group client. Don't forget that. And you don't tell me that you called the police. Or let's say you do tell me that you called the police.
I would inform you. I would definitely inform you.
Okay, so you inform me, hey, I'm going to call the police because why?
Because you're gonna commit suicide, you're threatening to cause harm to yourself.
Oh, okay. Well, if you would have just asked me to not do it, I would have done it. Why did you call the police? I feel really hurt by that. Why didn't you talk to me about this more? Why didn't you just ask, hey, can you promise me? You don't have
Because
to
I
say
did
shit.
it. Because I did it. We talked a
Because
lot
You
about
you
that.
just said
And
that
you
they were
kept-
gonna do it right after the meeting and
Yep.
there's gonna be no time to talk, so that's why I did it.
But if you would have said, hey, can you promise me to not hurt yourself or take any of those steps, or if any of the steps or urges do increase, you could contact me immediately,
It's too late, you had
or
to.
you call the police. You promise to do that. So one of the next steps you want to, at that point, would want to take is to verbally contract them, right? So verbally contract them, say, hey, can you promise me that you're going to be safe tonight, right? If they don't have a plan of action, if they are able to verbally commit, then you make sure you include that in whatever the documentation you have with your group, and then you try and set up a safety plan, right? You set up, okay, well, who do you have at home? Who are your top 3 people or top 1 person that you can call should these urges increase? Can you give me on a scale of 1 to 10? 10 being really a very strong urge, 1 being not at all. What is the urge right now? Do you
Do
have
they
that?
do that?
Mm-hmm. Well, you make sure you do that
Isn't there
as a
some
therapist.
research?
But yeah, and they should tell you. If they don't tell you, if they do have a plan of action, if they're very resistant, if they don't verbally contract and say, no, I'm not going to promise you, then that's when you take the next step and say, well, then I am going to contact the police. So, you make necessary arrangements for that. Then let's say they say, okay, I'll promise you. And okay, and you can even write out a safety contract, which is very true. And again, you have a lot of training on this. I'm just briefly giving you an idea about what those steps look like, but you are trained on what safety contracts look like. Usually wherever you work, they will already have pre-made safety contracts. You can even Google them. They have lots of safety contracts. You have them sign it, so at least you're covered legally. And you set up a safety plan. There are lots of safety plans online, and even probably at your facility. where you've identified a few people, you identify a few coping skills, you follow up with them, you make sure that their parents are aware if it is under 18, you make sure their family is aware even if they're over 18, and you make sure that you have informed consent. So that's where another opportunity could arise. Hey, I need you to sign informed consent so that way I can speak with your mother or I can speak with your wife about what you just told me, so that way, again, we can follow this safety plan. You have screening of participants, which could really contribute to this. What if you have a group on suicide? What if all your clients are at risk of suicide? Again, that's where you want to make sure you're screening them properly, make sure everyone is aware of safety plans. That's where you probably have a lot more preparation. That's where you have a lot more training. And again, a lot of these issues you're going to be trained on more on the graduate level, and then even more during your internship, and then even more wherever you work. You have lots and lots and lots and lots of training. So we are basically just hitting the surface here, but that's basically, yeah, what I want to cover that. Any questions?
Yeah, isn't there a research or something, I forgot, they did it recently, where they say like a person is intent to do something within like 90 seconds or something. If you can stall them for that time, it lessens the possibility of them actually following through with whatever action they were thinking about, something to that effect.
I've heard of something like that. Yeah.
What about calling 211 also? Those helplines?
Yeah, you could. Yeah. It really depends on your preference as well, and what you want to do as a therapist, what you want to do to make sure you're covered legally and ethically, to make sure you're doing everything in your power, all with the exception of going home with them, right? Of make sure they arrive home safely and stay safe. This has happened.
With the whole group.
Gosh, I can't tell you how many times that has happened. I recommend an internship at a treatment facility. I recommend working at least in a treatment facility for a year. Usually treatment facilities are really tough. They have high burnout because they have really, really severe caseloads. They have really, really severe behaviors you're dealing with each client, long histories of trauma, of substance use, of co-occurring disorders. Again, I think it's great training. Not everyone stays in it for the long term because it can be really emotionally draining, but it really prepares you for private practice. So I'll give you an example. I was in individual therapy. I was meeting with a gentleman. It was late at night. The private practice is open till 9 p.m. I think it was like 7 or 8, but I was one of the last therapists there. And this gentleman mentioned how he wanted to commit suicide. And he got fired at work. He relapsed. Literally hours before coming to the session, he reeked of alcohol, actually. I almost discontinued the therapy session just to make sure we can make plans for him safely, but I let him vent. And then after 30 minutes, I said, okay, now we're going to be talking about safety plan. We're going to call someone to pick you up. We're going to let someone know, get informed consent. The private practice was located right across the street from the hospital. So even if he wasn't able to get a ride, we can say, listen, you're going to go into the ER. And again, just taking all the necessary steps, making sure you allot time for that as well, because I could have easily had an hour session and then spend another 30 or 40 minutes with him trying to coordinate all this, but say, listen, this is going to be a part of the therapy session. We need to make sure you're safe. We need to make sure you have a safety contract. We're going to get some consent forms signed. And then his ride, who was going to pick him up, was running late because in DC traffic, the traffic's horrible. And I ended up staying at the private practice with this gentleman. I would not leave this gentleman until who we designated as his driver to pick him up, right? So those are appropriate times where you listen, honey or family or whoever, I'm going to be late. There's an emergency situation at work. I should be home soon, but let you know more later, right? And that's where you stay with the client until the safety plan is accomplished. I've only had to do that once in private practice.
Professor, you ever had a client that had the personality of an onion peel?
What does that mean? They're very, very, very guarded.
Very,
Yes.
You peel one,
Yes.
and there's another one there. How did that work out?
Well, I think in reality that's almost every personality, whether we realize it or not. But I would say I probably had maybe only one client who was not an onion. Everyone else is very large onions. But that's the beauty. That's the fun part. I really enjoy that part. I think if you think about it as an adventure, a journey, and really exploring with the client those layers, right? And really helping unpeel those layers. It is like a puzzle in a lot of different ways. They don't necessarily know why they do what they do, so it's a part of your job to help put the pieces together to create a formula that's going to help them behaviorally, no matter what situation, right? We don't want them just to be successful at this lower level of care where they have 24-hour monitoring supervision, where they have locked doors, they're basically told what to do 24 hours a day. While they're successful at that level, that's great, that's good, we want to start somewhere, but we don't want to leave them there, right? In order for that to happen, we start unpeeling more and more layers, and we start helping them to be successful at any location, whether they're in a locked facility or whether they're free out in the community or whether they're in their hometown or whether they're in Canada. They're going to have a behavioral formula that works for them. They're going to be able to use skills, and no matter where they're located, to be successful. That takes a lot of work. It's a large onion. But I think that's everyone at the end of the day.
I have a question. You mentioned that they usually don't know why they behave a certain way, right? And our job is to try and put the puzzle pieces together. When we do have a fairly good idea of what's happening, the pattern in there.
Yep.
When is it? Because sometimes it's not, the client's not ready to hear why they behave a certain way, or because if you tell them too early, they might just, and they're usually very anxious to know why am I doing this? Why do I behave this way? So, because if they don't have the coping skills to deal with why they behave a certain way, then it can really do a number on them. So,
right.
How do you? Like, it just takes training? Is that what?
It really, even with training, it comes down to your relationship with the client. It depends on your rapport. It is really important to keep your supervisor up to date on that until you learn. And you'll have plenty of opportunities to really learn about that. How should I phrase it? When should I bring it up? Talking to your supervisor consistently, which is why you have to meet with your supervisor at least once every week to go over every client that you have on your caseload, is because of this reason. Hey, do you think this is now a good time? Or do you think this is a good time maybe a few months from now? Or maybe your supervisor will say, hey, you know what, remember you wanted to mention this part to your client? This may be a good time to do that. And here's how we can phrase it to lower their defenses and still maintain the positive rapport. It really is an art in that way. I don't think there's any one specific formula for a therapist to really do it. Again, that's where therapists have these eclectic approaches, right? Are you going to take a strengths-based approach? Are you going to take a cognitive behavioral approach? Are you going to be more behavioral modification? It all depends on your client. It can depend on your client's personality. It can depend on your client's IQ level. It can depend on your client's culture. It can depend on your client's family dynamic. It really depends on the individual, and then getting to gauge that individual and understand what are some of their triggers. Do they like when you're more direct? Do they appreciate that, or do they like it when it's more couched? Do they like it when, XYZ, or do they like it ABC? Yeah. So it really comes down to that, and then using those counseling skills of being able to communicate effectively in a positive way.
Wow.
Mm-hmm.
Wow.
Yeah. Sorry, no quick good answer for that one. As much as I would love for them to be one.
Wow.
All right, so consider 3 dimensions. There's age, culture, ethnicity, gender, sexual orientation, and social class. Sexual orientation and gender, as we all know from our political climate, that are becoming much more controversial in some ways. So it's really important that you keep that in mind. And how are you going to deal with it as a Christian clinical counselor? What are the rules of wherever you work, or the rules of the church, or the treatment center, or even the private practice? Make sure that if you have any questions, you talk with your supervisor or your research. Make sure you find a way to include these 3 dimensions. There's also education, geographic region, spiritual beliefs, historical era, and current social context. So basically everything, right? I don't know if there's anything left for us to consider.
Wow.
Again, you really just want to be more aware not only of your group but also of yourself. I think this really hits home for how you function as a therapist, how you function as the facilitator. A really good rule is to never assume anything. Don't assume someone is a certain sexual orientation because of maybe how they act or how they dress or what other people say about that person. If everyone else says, oh, that person is lesbian or gay, don't take their word for it. Don't assume anything because that also can be really offensive, right? If we're looking at spiritual beliefs, don't assume someone is Muslim or someone follows Islam because of how they dress or how they speak or because of their accent, right? We really just want to make sure as facilitators we're self-aware because, again, that really can have a negative impact on your group. So diversity within your group is becoming really important. The theme we want to cultivate is unity in diversity, right? Even though we come from all these different places, all in different backgrounds and different spiritual belief systems, we want to make sure we can be united. And one way we can unite and connect is we all have the same struggle. We all have a problem with addiction or a problem with whatever the case might be, depending on your group, regardless of age, sex, gender, socioeconomic bracket, etc. All right, so managing diversity in groups, ethnicity, all group counseling is cross-cultural. What do you think that means? Yeah, as we are learning, and especially learning more about genetics, we all come from different cultures, we all come from different ethnicities. It's really, really important to remember that and to treat all groups as such. Group leaders facilitate balance of power and status among group members, develop awareness of personal values and the worldview of the group members, provide culturally appropriate intervention. So let's start back up with the second. Group leaders facilitate balance of power and status among group members. What do you do when a group member takes over the group and thinks they're the therapist because they just had a breakthrough in therapy? They are the ones facilitating. They're the ones correcting group members. They're the ones who are correcting you. Saying you're not really doing a good job. You're not really as assertive as you should be as a facilitator or a therapist. Therefore, they're leading the group.
Right.
What do you do?
Yeah.
You sit them down, you take them outside, you correct
Yeah,
them, bring them
Okay.
back in.
Okay, that's one approach. That makes sense. What else do you do? How can you facilitate balance of power in the group? Let's say you don't have the opportunity to even wait till the end of the group. It just started. It's an hour and a half group. It's going to be a very long hour and a half. If you have to wait till the very end to correct this guy.
If it's a, let's say it's a 12-step group,
Okay.
we reiterate the rules of the group.
Okay.
Because they have rules.
Oh, so if it has
there's
rules,
no
that's a good
cross-talking.
point.
There
Okay,
is
good.
no, one
Mhm.
person is not allowed to isolate everybody else from the conversation, and so on and so forth. So you reiterate those groups and be a little bit more stern about it.
Okay. Yes. Yes.
You change the conversation, you reroute the conversation.
How can you reroute if this guy is rerouting you elsewhere?
You just
Or is
say-
taking over your job and
You just say,
rerouting
"Hold-
everything?
Hold on, I just had a thought.
Okay, that's creative. That's one way you could do it. And that may work. Right? The important part is you understand yourself, right? A big part of leading groups effectively, especially in substance abuse, is for you to understand your level of assertiveness, of comfortability, of even style leading others. Right? I've had some group facilitators who remain silent the entire time, and it's very intentional. Even when they're called out by people for the facilitator to speak or to be more assertive, intentionally says no. And there is a lot of evidence that supports that one type of modality, but as we're finding, there are lots of different approaches with substance abuse. There are lots of different approaches with facilitating groups, right? And how the group will take shape on its own. And as a therapist, you can just sit back and let it go and make observations. And at the very end, share those observations. Or you can try and be more proactive. If it's starting to hurt other people or things like that, maybe you end the group right then and there. Or maybe you come up with that creative idea saying, oh, I just set it up. Right? The important part is knowing yourself and your level of comfortability, because you can become really, really uncomfortable in these really tense situations that is okay. It's okay to be uncomfortable. It's completely common, to say the least, especially in group settings. The important part is practice, right? Learning more about yourself, and then going to your professor or going to your supervisor or going to whoever it might be for feedback. Say, hey, look, this is what happened. Man, I was really uncomfortable. Oh, I've had so many uncomfortable situations. Let me tell you, here are a few tips that have helped me. Maybe you can try these next time, right? I've been, as I said, in a lot of different groups, and oh my gosh, I've had so many groups that were so uncomfortable. Oh man. I think one of the worst groups, or some would say the best groups I've led, I would say probably the worst. Yeah, that was definitely the worst. The worst group I had was, I was leading it was an all-girl group, which I didn't want to begin with because these girls did not have a good rap. These girls were really, really tough. And I led the group. I was actually in the group for probably a good 4 or 5 weeks at that point. It had themes and it was very, very structured because these were very, very, very unsafe girls. And that had very, very extreme and traumatic backgrounds. And unfortunately, I don't know necessarily what happened. We had to process the group for about a week afterwards, but one girl attacked another girl, basically pulling at her hair and screaming, kicking her. And we had to call for staff and security and all that. But that was probably one of the worst groups. I think that was the worst group. Some beg to differ. Some therapists actually said, no, I think that's actually where we needed to go with there. I think I'm actually glad you went there. They all needed, it was because it was a very vulnerable topic. And we've all discussed the topic beforehand. It was actually like a 2-week build-up to that point, saying, hey, listen, remember, this is a very emotional topic. We're going to be talking about this, this, and this. And maybe it's a closed group where it's we actually all had confidential statements that we all made together saying, hey, listen, we're not going to talk about what is said in this group outside of here because then the girls can use it against each other, saying, oh, you said this in group, and use that against them, which is not good. But it was a very emotionally triggering topic, and actually the girl had a very severe background to begin with, who was like on her 10th strike at the facility and ended up being shipped off to jail. So that's probably one of the worst groups. But again, I say all of that to let you know if you ever get uncomfortable in a group,
Normal.
it's completely normal. And it probably won't be your last. And that's okay.
Burn out.
You really do. The great part is you grow from it. And I really believe I could take on any group now. I feel so much more confident than I ever had in the past. So especially this group is amazing compared to the group that oh man. No one's cursing at me, no one's yelling, no one's throwing anything. I mean, this is wonderful. All right. So let's go to the next slide.
Self-awareness also reduces bias, right? If you're aware of your own.
Yes, it's supposed to ideally reduce bias, and I think it does at the end of the day. I say it's really hard to be completely objective. I don't think it's possible. We want to try and be as unbiased as possible. I think, again, it's really important to recognize our humanness and say, hey, listen, at the end of the day, as objective as I'm going to be, if I seem unfair or if I am making assumptions that I don't realize, please let me know, right? And to just be really transparent about that human factor. I do at times, without knowing it, tend to be a little bit more biased. When someone calls me out on it, I try to be as open as possible to it. I really want to make sure I'm being fair to everyone. And a lot of people respect that, and that's usually good enough. But the more you realize about yourself, typically the better.
Well, Professor, what about your health? You getting some good sleep? It seems like you're going to need good sleep, good diet, and all that. How does that work for you? Was you able to take care of all that?
I'm probably not the best person to speak about that. I actually worked 3 jobs while studying and going to school at the same time. I worked 40 to 50 hours at the residential treatment center called North Spring, worked about 10 hours a week in addition to my 40 to 50 hours at private practice called Riverside Counseling. And then for a 9-month stint, I worked a 3rd job working with adolescent sexual offenders at a clinical forensic in psychology, which was like 45 minutes away. I did not see my family at all for like about 2 years. So I really loved what I did. I really, really enjoyed it. I think that's what made it possible. It's really important though that you maintain that work-life balance. Don't do as I do. Just do what I say. I know I'm not like everyone. I'm a little bit more extreme, but that's not always good. In this case, I mean, I benefited a little bit because I got a lot of experience. I got a ton of experience in a really short amount of time. But it's really crucial to maintain that work-life balance. And it's even more important in this field to make sure you are sleeping, make sure you are maintaining those boundaries of, hey, look, I learned to say no very fast. I used to really struggle with saying no all throughout my undergraduate and graduate career, all the time. It was really, I was overcommitted all throughout undergraduate and graduate school. I was in too many activities. I worked too much. I studied too much. I overextended myself. I quickly learned in this field to say no and be very happy to say no. And again, the lesson for me was to say no in a way that I felt comfortable. I didn't like to be very abrupt and say no, right? And say no, thank you. Even though thank you seemed really rude to me. I was first learning that about myself, that I don't like to say no, and then realizing more specifically that I don't like saying no in a certain way because I think it can be interpreted rudely. I don't want to be interpreted that way. So it really comes down to finding ways and really strategically thinking about ways to say no and varying it and really being confident in that. So that's what it took me. It really depends, but I really do encourage boundaries, knowing yourself first and foremost in order to establish those boundaries, right? I knew myself. I knew I really like this field. I really love a challenge, sometimes too much, which is why I was able to take that route and be really good at it. I really enjoyed it. I think I was pretty successful, but it really comes down to knowing yourself, right? And really knowing who you are as a person.
Yourself.
Yes, really important. Gender. Residential treatment groups are usually composed of all one gender. This is very true. I mentioned that I was in charge of an all-girl group. That's very rare. It's very rare. And when I was all throughout internship and even my first job in Maryland, I worked with all males. And that's because the treatment facility in my internship was an all-male facility. And that's because my first job in Maryland was at a school and they sectioned it off, all girls on one side, all boys on one side, right? So that's because they resided there. It was a residential treatment school where they went to school and lived in the same place because they were all under the age of 18. They needed to get education, but also needed to be treated for severe psychotic disorders. So it really is pretty much the case for that. Very rare that you have working with the opposite gender. So this limits members' ability to work through family of origin or cross-gender relationship issues. That's very true. Not all men appreciate groups, which is very true also, because they have not been socialized to talk about the problems with others. That's very true. When working in the men's facility, groups are very dry. That's where psychoeducational came into play, and that's where taking the group to a more vulnerable place was a little bit more difficult, but worthwhile in the end. It really depends on your group. I've heard and have some experience working with female groups where it is almost the opposite, right? Where everybody wants to say, and if they don't get to share, they're really upset because why did that person have 5 minutes to talk and I only have 3 minutes? Why did that person get to hit on that topic and I didn't? Where they would love to share, which is really good in some cases, but at the end of the day, it really depends on your group, reading your group, because you want to make sure that the group isn't taking advantage of anyone else, right? Oh, well, I'm going to talk a little bit more because I know if I talk about this topic, this girl doesn't like that topic. It's going to make her uncomfortable, and she really upset me last week, so I'm going to talk all about this topic today, right? Or et cetera, et cetera. So it's really making sure you understand your group. Groups are really dynamic. Could be really great, and also really be not so great. Sexuality. Sexual identity stereotypes require sensitivity and planning. Group leader can teach and model respect. I think that's the most important part, is to make sure you maintain respect no matter sexual orientation, despite sexual stereotypes, etc. It's really important. I think it goes a long way. Type of addiction in groups. Alcoholics may prefer being with other alcoholics. That's very common, at least in my experience, where alcoholics, people who attend AA will not like to go to NA because that's a totally separate issue. They don't see a connection anyway. Whatever, it's fine with them, as long as they're going to some help. group. But just knowing that about the client is really important. Clients who abuse drugs are more open to groups that address multiple substances, difficult for facilitators to navigate. So, yeah, it can be difficult to navigate. If you have narcotics and alcoholics in one group, which you very well might have in residential treatment facilities, it's a matter of just practice, preparing, learning, asking your boss or coworkers, hey, how did you manage that group? Sometimes you'll alternate groups, right? How did you get into that? And of course, going into the helping profession, the great part is that your coworkers will love to help you. They love to help each other.
Strange, isn't it? You have 6 person narcotics and 1 alcoholic.
Mm-hmm. Yeah. So how do you manage that? So let's say you have 6 Narcotics Anonymous members and 1 Alcoholics
I would
Anonymous member.
refer to the group of alcoholic.
You refer to the group as what?
This one person, I would refer.
Oh, okay. So you can refer him out. What if the AA person wants to stay though? And the 6 AA people don't want him there?
Wow, that's
Why not? But
Good.
why?
Yeah. Why?
Why?
Talk about it.
Yeah.
You know what? Let's get group started. We're gonna talk.
What's your motivations?
Yes. Yes. Exactly. And again, you'll learn a lot more about that in group counseling class. If you haven't had it yet. For those of you, have anyone taken it?
No.
yeah.
Oh,
Okay.
come on.
I haven't.
Okay.
It's good.
Come on.
Who taught it for you? Was it?
Josiah.
Okay.
Yeah.
Okay.
Oh, the group counseling?
Yeah.
Oh, yeah, me too.
Yeah. Yeah. It's, I think, a really great topic. Okay, so group counseling for family members of addicts, changing family system will likely assist addicts in sustaining change. Learn new ways of coping, acceptance of the addiction, knowledge that individual is ill and needs treatment, become educated about addiction, share experiences, and then again we had Al-Anon, Narana, and ACO. Basically, all these groups are for family members. And that's one of the reasons why family is so important when we're talking about substance abuse counseling. We want to make sure we include the family. We must include the family, according to research, to be the most effective.
Oh yeah, the
You
quiz.
must
Like-
know. You must.
You must.
No.
You must include family.
There is something.
Yes.
No. You.
There's something there.
According to research, in order to be the most
you need
effective.
to know how
What if the
addiction
family
affects
doesn't
the family. This is what you need. You need to know how addiction affects it.
I think that the family can participate in many stands. It will be helpful because everybody will be in the same
Yes.
page.
But you
So it'll be
must.
very helpful. But it's good. It's
I-
probably good.
I think the
But they
key word-
must not, because sometimes the person has to be out of the family in order to be
I
good.
think the
the
key
family
word
is
here
too crazy.
is that
Must.
in order to be the most effective, you
The
must.
Most okay.
In order to be the most effective, you must include
No,
family.
must
Actually, what's the text, right?
Must
Text.
I think it was a test or the quiz.
The quiz. The quiz.
Yeah.
Professor.
Must
No,
be
because you
must.
have
Otherwise, I think you're wrong.
reconsider the must. The must.
I will preface this. Almost every question I get, I think every question. No, there's like 1 or 2 exceptions, but this one I'm pretty sure was that I get from the book. All the questions I get.
It's here. In order to offer the best treatment sponsor, need to know.
But I'll try and find it and see if I made a
Because I think
mistake.
We saw where. No.
I believe it was at the end of one of the chapters. I can't remember. It was like one of the last pages. of the
Oh, so it's a
summary.
contradiction.
But I'll find it.
So it's a
I'll see.
contradiction.
Did you see it?
No.
I didn't see it either, you know?
Must.
I will definitely look onto it because I love, again, a challenge. And I really want to encourage you, if you think that an answer is incorrect and you can find where the evidence for the answer being incorrect, please show me. I love to talk about it. And you very well could earn the point. So please don't shy away from
What if
it.
what if the family's enabling the person?
Well,
Whatever, but it's
Exactly.
Yeah.
Even more reason why to include the family.
I have 2 reasons.
Because how effective is that individual going to be if, for example, they're a minor? What if they're under 18 and have to go back in that family environment?
Yeah, there is a case that I did it with Dr. Lewis. You know, the person has to be totally out of the family because the family wasn't helping at all.
And the only way you're going to find out if the family is resistant to treatment is by inviting them to treatment. I've had this many, many times where we've had to go to court and fight for the parents to remove their rights and fight for the child to be taken out of their parents' custody.
Yeah, that's one.
Yeah.
That's
Oh,
one
yeah.
case. Yeah.
Because I raised 4 children that were, go through something like that.
Yeah. Oh, yeah. Yeah,
But there's some case that you need to. Some case the child has to be taken out.
that's correct. Correct. And that's a very effective approach because we're inviting them to treatment. We're seeing, we're assessing, hey, are these people able to provide a safe environment for the child? Okay, so strategies for effective group treatment: maintain safety, address outbursts directly and quickly, encourage normal tones of voice, contract with members to practice new skills in group, make resentments overt to address anger, ask members to repeat what another said if tension arises. So again, these are just hints and keys that you'll learn a lot in group therapy, reflective listening, you hear a lot in counseling skills. One of the best ways to really de-escalate a conversation is for the other person to repeat back to the person who's angry what they said, right? So let's say we get into a conflict. So Anita says something, then I get really offended by it, and let's say, Mary, you're the therapist facilitator, you address it quickly, and say, okay, you know what, Daniel, what did you just hear Anita say? And then I'll repeat back to her, and then you can ask Anita, what did you hear Daniel say originally? Okay, and then she repeats back. The reason why that happens is because a lot of times when we're upset, we check out, right? We have the monologue inside of our own head and begin refuting what they say before they even finish, right? So let's say Anita says something within the first 2 sentences, she triggers me and she makes me upset. She continues, though, to talk for 2 more minutes, but already in my head, the only sentences I heard are the first 2, and I'm already inside of my own head and refuting what she's saying. And then when she finally takes a pause or is done speaking, I say, you know what, blah, 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 and I go off with my points. The reason why reflective listening is so important, because a lot of times, which has happened a lot, they'll say, wait, I don't know, I didn't hear her. Or can you repeat what you said? I don't know, I only heard the first 2 sentences, and that's when I got pissed. I said, oh, okay, well now we're getting somewhere. It's like, hey, maybe if you heard the entire 2 minutes of what she said, maybe that would have helped. Or maybe you would have learned or heard something different that may have helped. So it's really, really important to use that again. That's why they say ask members to repeat when the tension arises. This also goes into education. You can have a psycho-educational group about this in a group before that even happens, saying, hey, listen, one of the rules is that whenever you get upset, this is the approach we're going to take, and here's why. So really, really good, and a lot of really good ways to run a group, but that, again, there are a lot of ways to run that. Ask those in conflict to identify their similarities. That's a good one. Dismantle subgroups, directly deal with members who monopolize group time, allow for shifts between emotions and thoughts. Any questions on this?
Yes, when you say like you're asking questions, then you could ask like, let's say Alita, is that what you meant, what she said?
Exactly, right. Make sure we're at least listening to each other. Because a lot of times that's the first thing to go. I don't even know what you said. I only heard the things I didn't like, right? And that's another reason why similarities can be so helpful. Okay, well, before you talk about what you disagree with on almost every level, there must be something you like, or must be something you agree on. What is it? You can go in that direction. Yep. Oh, okay, and just in time for a break. Okay, so take about 15 minutes, come back at 8:45, and we'll continue. Okay. All right, I'm taking a seat because usually I can lean on my podium, but my podium has the laptop, so I'm sitting today. All right, I did want to talk about the question mentioned about the quiz, at least so you can see where I got it. If you want to read it and try and dispute, please. I think it's a great conversation.
I will dispute, Mr. Capuzzi.
It's on page 322, and I'll read the whole paragraph so that way you understand the context, at least a little. Summary and some final notations. It's in chapter 14, the very last page, basically, of summary. Addiction affects not only the addicted person, it affects whole families, particularly the partners and children of substance abusers. Family members respond as best they can to addiction, but frequently end up maintaining instead of eliminating the addiction. Addicted family systems tend to be characterized by unhealthy interactions and can result in most family members experiencing negative physical and emotional outcomes. Consequently, in order to provide the most effective service delivery, counselors must include the entire family in addictions treatment. I'll repeat that. So, in order to provide the most effective service delivery, counselors must include the entire family in addictions
But
treatment.
not in capital letter.
What's that?
Capital letters.
No, capital, no capital.
That is
This
true.
is not correct.
Nothing-
This is like in some cases, he should have put like in some cases,
This one
okay,
I
but not all
put
cases.
right, don't do it.
In my experience,
Okay.
I would say the research holds true. The most effective treatment with addiction is.
Yeah, I heard we should not believe all these statistics, you know.
Did you correct the test? No, I didn't see it.
This class, I'm
The
flying
test?
by with
Did you
my
correct
scores.
the quiz 4? No.
Yeah.
I don't have
Yeah,
that.
Because-
you did it. I didn't see it.
Because of the case that I studied and that I did work on it, you know, I thought about them when I read that question, so it cannot be, you know, because these people be in very bad shape. Yeah, really, that's something, that's people do mistakes.
That's true.
All right, so let's continue. Talking about groups. Now, again, this is the 12-step process. It is not required reading. You do not have to read chapter 12. If you want to read chapter 12, you can. I am not requiring you to read chapter 12 because you're writing 3 reflection papers on these meetings. So I don't really see the need for you to read it. I am and do see the need for you to at least hear about it. So I'm going to explain a little bit to you if you have any questions, because you've been to some already or will be going to some hopefully very, very soon because you have to attend 3. This could be a time to clear that. Okay. 12-step groups, also called self-help groups. Not all groups have 12 steps. In person and on internet, members gain knowledge, obtain, and provide support. Affiliation with 12-step groups is consistently linked with achievement of abstinence. Counselors should be familiar with them because why?
Because you're gonna refer it to it also.
Most likely, 99.99% of the time, you will refer them to AA groups because why do you want to refer them?
Because it gives results.
Hmm.
And provides them with a support group so that they can share if they.
The research,
Some don't.
the
you
research
know.
actually is pretty weak when it comes to.
I read that, I read too. But again, research. I know that I've been going every week to recovery, celebrity recovery, and I've been seeing a lot of
No, it is so true.
miraculous
Even
change
though-
in people.
Even though there is not much research to support it, there is at least this camaraderie that produces results.
And then there are other groups that open, you know, with 12 steps without the religious part, you know, some
Mhm.
people really don't want to hear
Right,
the-
right.
anything about religion.
right.
You know, I have a feeling inside of me they have to put it down, the other one. Because he's the one who created, and other people use it, and they think they have the best one.
Okay, so let me ask you this. If you're an evidence-based Christian clinical counselor, that means you know your Bible, you know your counseling, you know all the evidence-based practices related to substance abuse. Why are you referring me to an AA group that has really low correlated research, really low evidence to support that I will actually maintain recovery?
Because it normalizes it gives you evidence that you're not alone.
And
Okay,
they're
there we go.
secular. They're more secular.
They can be more secular. It really depends, I guess, on the type of group. But at the end of the day, the common denominator with these groups is that it's a group. you have people, you can make connections, you can make relationships. Hopefully they find a group, because not all groups will be the best, but a group that they find that they work best with at the end of the day. We really want to encourage relationships. We really want to cultivate that type of connection, because one of the best ways to change the shape of your brain is through relationships. So if the client has a lot of unhealthy relationships currently in their lives, then we can encourage the clients to forge or create new healthy connections, perhaps at these groups, right? So it's just one of the reasons, but
It's free.
again, it won't always be the case. So history of 12-step groups, Alcoholics Anonymous, 1935 is most widely used. 1 in 10 adults in the U.S. has attended an AA meeting. By the end of this course, you will be part of that statistic. More than 2 million membership worldwide. Alcoholic Anonymous, first published in 1939. 12 steps and 12 traditions. Purpose is to achieve and maintain sobriety. So again, we want to maintain sobriety by achieving abstinence, not tolerance. They believe, at least the 12-step program believes, that you must refrain from all alcohol. No tolerance, no 1 cup a day, no only on the holidays or only on the weekends.
One
Right.
thing
So
that
the cold turkey.
Cold turkey.
one thing that the person told me is that one is not enough, and 1,000. No, 1 is too much. No, 1 is not enough, and 1,000 is not too much.
Yeah.
That's
Yeah.
what it.
Yeah.
1 is not enough, but 1,000 is not too much. So you cannot have 1.
Yeah, exactly.
That's the point.
Okay. And that's exactly my experience with addiction. That's very common. So that's one of their beliefs in the 12 steps.
Yeah, she said that
To achieve
you
maintain
can
sobriety.
go and drink 1 glass. I won't stop drinking for days.
Correct. Right.
This is
Yes, you will hear that a lot. That's very common. So a little bit more history of 12 steps is that you also have Al-Anon, borrowed and modified AA's 12 steps and 12 traditions applicable to the needs of families. Again, it's more so for the families of addicts struggling with codependency or enabling. Codependence Anonymous, CODA, founded in 1986, strives for healthy relationships, and autonomous groups in the U.S. and 40 other countries.
Wow. The
Now-
codependence? Really?
Yes, CODA.
Cool.
History
in this
of
case,
12-step
these are
groups.
codependents relating to the alcoholics, right?
Doesn't have to be, but
No.
usually is the
Okay.
case.
Okay.
Most of them are involved,
but there are of relationships too.
but it can be just relationships.
But
Yep.
you know,
In
Professor,
Brazil we have codependence.
Mhm.
I took care of elderly people for years,
Just that.
Mhm.
and I found out something about elderly people.
What's that?
They take their pills, and they be feeling pretty good. A lot of people don't know that, but they actually take their pills and they know exactly what they're doing. They take them, and when I say feeling pretty good, they become dependent on that feeling. A
Mhm.
lot of them do, not all of them, but a lot of them do, and they actually enjoy taking their pills.
I'm talking about abusing pills or taking prescribed
Yeah,
medication?
abuse their, some of them abuse their pills. We have to,
Oh, okay.
we had to, some of them we have to guard them to make sure that they don't overtake their pills, because they take them and they be feeling pretty good. I
Mhm.
just, and a lot of people don't even think about that. There's a lot of elderly people
Who may be
that will
addicted.
pop that pill, and if you're not watching them, if they free, especially if you go in private duty and go in their home, they
Mhm.
don't only have the pill, they have a drink with it. Valium was one of the most used pills. Well, let me take the drink. You see, so I'm saying that a lot of, and this is just bringing it back to me now,
Okay.
that these people, because I wasn't as aware as I am now, that they was enjoying it. Pretty good.
Okay. Okay. Narcotics Anonymous. Partnered or patterned after AA, all-inclusive, the disease called addiction, any mood-changing, mind-altering substances. You'll find in the field that there are almost rivalries for whatever reason. I'm not quite sure, but it seems like that there is some type of rivalry between the two. You have modified Al-Anon for teenagers. Goals: share experiences, learn to cope effectively, encourage each other. Other support groups: Rational Recovery, 1986. Alternative to AA and other 12-step programs, cognitive behavioral basis does not regard alcoholism as a disease. Negative self-defeating thought patterns. Discourages the ever-recovering drunk persona. No RR groups. Emphasis on self-efficacy, no steps, and no religious overtones. What is self-efficacy?
You speak for yourself. Well, I didn't say that right.
It's basically maximizing your potential, reaching your full potential is a simple way to put self-efficacy. It's used a lot in psychology. It's a way to reach ultimate self-awareness in some way.
Is it like similar to self-actualization?
Yes, exactly. Yes. It's almost a synonym for that.
Okay.
So they don't encourage abstinentism.
They don't encourage what?
So I think,
Abstinence.
so this group does encourage abstinence. They just don't believe in the perspective of constant recovery. So in an AA meeting, you never really identify as being recovered, but as still recovering.
Yeah.
Whereas this group says that it's possible to say you are recovered, but not pick up a drink again. Does that make sense?
This reason they say the name and I'm alcoholic. They never said, I'm an ex-alcoholic.
The difference would be an AA meeting would say, I'm an alcoholic with 25 years sobriety. And this meeting would say, I was an alcoholic and I have 25 years sobriety. So again, it's a plan where it tends, the reason it's so technical is because it has to do with cognitive behavioral therapy. It really emphasizes language because they emphasize the language, the messages you send to your brain. So it sounds like a slight difference. It sounds like it's no big deal, like, okay, I am an addict versus I was an addict. Okay, what's the big deal? But the big deal here is based on cognitive behavioral therapy, which emphasizes language, terminology, how you phrase the messages you send.
Like Heron, he said, I don't want to celebrate 3 years. I want to conquer 24 hours.
Yeah,
And
there you
he's
go.
still,
It's reframing it, right?
he's
Okay.
still fighting.
Right.
Yeah, I understand.
Well, yeah, it's a constant.
What does RR stand for again?
I think it's rational recovery.
Oh,
Yeah, so it's a rational way of thinking, right? And that's also why they move away from these religious overtones. It's more just about the rationality. They're like, hey, I'm treating this more in some ways objectively, I guess they can say, versus through a higher power.
Yeah, but
Yeah.
even rational
But do you-
recovery, it depends the way you put in religion, because the word of God also may be, there's no affirmation there that you should
Mhm.
say, I am recovering.
The only problem I have with the higher power deal is this, is that anything can be a higher power.
Mhm.
So, when you go into Alcoholics Anonymous and you hear them start referring to the higher power, you have to ask yourself, what is your higher power?
Right.
What is it that you're, now the higher power becomes a crutch.
Okay.
So for me, personally, when I was smoking cigarettes, my crutch became the gym.
Okay. Yeah.
So I quit smoking, but now the crutch is the gym.
Mhm.
So now I'm at the gym constantly because I don't want to fall back to smoke.
Okay. Yeah.
Does it make sense?
Yep.
So with that same essence, so now my higher power is the gym.
Okay. Yeah. Yeah. Mhm.
So that's the only issue I have with the AA aspect of the higher power. But the only reason they changed it because AA used to be a Christian program. Okay. And the only reason they changed is because there was a lot of complaints for
Mhm.
non-Christians who were like, hey,
Right.
you know,
But
so
they're
they
also,
changed it, they made it higher power, but like you're talking cognitive behavioral therapy, it emphasizes words, well, if you're just saying higher power, you have to define what that higher power is.
Mm-hmm.
Talking about recovering and recovered, the Word of God teaches about the power of our word,
Mhm.
So it has nothing to do, this recovery has to do with the author who put this there, not with the Bible, because the power, we have the power of the word, we can kill with the tongue, so if you keep saying I'm recovering, this means you're forever recovering. If you say I'm recovered, it's like the message that you send it to your mind, that you recover. You end up recovered.
Okay.
Never fully recovered.
the one, I love that notion, but at the same time, when you have the sense of recovered, yes, you are recovered for today. But the thing is, you never, because if you don't take it one step at a time, one day at
You
a
have
time,
to take
you
a
may-
step at a time. I
Exactly.
agree with that, but you're not forever taking step at a time. Like
No, you are.
recovering. I am recovered. I didn't fail. I know
Yeah,
that for sure.
right.
That's my experience.
I
I'm
agree.
talking about for you. I'm talking about
No,
for
no, I'm
me.
not talking for
And
me, I'm
this
talking
what-
in general, if you look
this is-
statistically, people,
I
the
don't think
relapse rate is higher.
statistically make me even nervous. This word. But my own experience, what I went through in my life, for me it worked to bring to my mind, I'm done with this. I'm done, totally done. I'm not like, oh, I relapsed here. No, you can shower me with alcohol.
So the great
It's a
part.
John 8.
So the great part
36.
about this is we have all these different opinions. Which do you tell your client? Do you say recovered or recovering? Or do you say something else?
Does it matter? I say something else.
What would you say?
It
Something
depends on the
else.
case of each person.
Okay.
Well,
And
You
how
can
do
be
you?
recovering and you can not recover.
Okay. What are you gonna say?
even in the Bible, Hebrews 2:1, it says, therefore we ought to give the more earnest heed to the things which we have heard, because at any time we should let them slip. So even in the word, we have to be careful that we cover that.
We're not
Keep-
recovered, we're recovering.
But the other parts in the Bible that also say that, you hold on to what you want. I want to be like, I can be
For
you
you.
by the blood of Jesus.
But
It's
that's
For
not
you.
like that's
Each
for me.
one has the verse.
Exactly,
For
that's for
her was John 8:36. Therefore, if the Son makes you free, you shall be free indeed.
Amen. That's the one
For
I hold
her,
on.
that's that verse. And for a person, I have a friend, he was drug addict, cocaine and alcohol, and his father was paying for the college. He said, this is stupidity. I'm not gonna do that. He was not Christian. He said, I'm out, done. I met him, he was
That's what I
married,
thought.
sons
Done.
and daughters, no drugs, no 12 steps, anything. He said, done.
So the great part about learning all of these groups and how each group looks at addiction differently is to educate your clients, right? You can run a psychoeducational group about all the different help groups out there and the differences of all the groups out there. Then your client decides which he or she thinks is best. Hey, I'm going to go to this rational reasoning group because of ABC reason, and I like that better than the AA group because of XYZ reason, right? So again, it really comes down to your client. And one of the goals as a therapist in relation to your client is to inform your client of options. And inform them of options. Hey, listen, based on the research, based on these research results, these are options. And here's how other people think about it. What do you think? Which one resonates with you most and why?
Work
Right.
best for the person.
Yeah.
I just think that being therapists, one of our biggest things that we're going to be doing all the time is research and numbers.
because that's going to speak volumes. When you start ignoring numbers, you start ignoring fact.
Mm-hmm.
And
Yes, you will be required when you're licensed to complete continuing education credits, which have to do with a lot of research. Just stay in the loop with what research are saying about your field.
Yeah, I don't mind to stay. I do.
You have to.
It
Many
doesn't mean
things
you're
I
gonna be-
agree, other things I don't, but
Right.
I'll stay at loop. So we
Yeah,
need
you'll
to
stay
know what's
informed.
going
It doesn't
on.
mean you're conducting research, doesn't mean that you are calculating statistics. If you want, you can. There is a big need
I
for
think my
it.
point wasn't that you're doing the statistics, but that you have to use those numbers
Mhm.
in order to be effective in how you're treating your client. In other words, you don't want to omit that type of information and tell your client, hey, listen, I'm going to sell you a fairy tale. You're going to be okay tomorrow, because it doesn't work for everybody.
Mhm.
Everybody,
Right.
some people just sit there and go, well,
That's treatment. You
You know,
don't know if
mhm.
the person is gonna be okay or
So
not.
how long do you have to take, I mean, like every year or every 2 years? You have to.
Continuing education credits depends on your state. It really depends on your state. So Florida, I believe, is every 2 years you have to take so many continuing education credits.
Because I have to do that for cosmetology.
Yeah, a lot of fields have that. You just stay current on the research.
477.
In 1975, Women for Sobriety, WFS, founded by women for women, founded on the theory that AA programs fail women.
Mm.
Alcoholics Anonymous for atheists and agnostics, Quad A in 1994, downplays the role of religion. Members have the power of themselves. Moderation Management, 1994, goals chosen by the individual, controlled drinking programs.
So this one doesn't focus on abstinence.
That's more tolerance.
Yeah.
Yep. So that's moderation management. So they believe in moderation versus abstinence, or tolerance versus abstinence. National Association for Children of Alcoholics, 1983, founded by professional support and information, confidential phone, website, and correspondence. Alcoholics Anonymous, the 12 steps and 12 traditions, open and closed meetings, discussion participation meetings, speaker meetings, step meetings, big book meetings. So they have all different types of meetings. Open and closed means that open to the public, closed is not open to the public. Then you have the big book, which is basically the Alcoholics Anonymous book, where it talks in detail about the 12 steps and all these different perspectives on how to stay sober, maintain recovery.
So a lot of people, a good percentage of people overcome through recovery through the 12-step program.
So if we're going to talk about statistics, here are statistics for substance abuse. 1/3 will get clean and remain clean after the first treatment, going to a treatment center or getting help. Another third will have to go through treatment multiple times and will eventually get clean. And then the other third ends up going to jail or dying and never getting out. So it's a rough road. So you're looking at 33% after the first time will get it and stay clean. The rest will either die and go to jail or need to go through treatment multiple times.
It's just like a video of the
Correct. Exactly. The video of the basketball player, you saw how many, not only treatment, not only treatments he needed to succeed, but how many overdoses it took for him to realize how much he needed help to succeed.
My daughter, I raised 4 of her kids. I got them through court.
Mm-hmm.
She had got strung out.
Okay.
And I would go there at night, stay with the kids. They went through a lot. And I told her I would let her stay with me when she got in trouble. But then she would bring I would wake up and people all over the floor, still taking stuff. I did that several times. Then the last time she called me, it hurted me. I said, never, I can't take it.
Mm.
But because I didn't do that, now she keeps her own house.
Mm-hmm.
She is furnished, she's paying her bills, she's buying her groceries, and she's not on heavy drugs, but she's a cannabis now. So at least she's better than she was. She was really like strung out one time when I got kids, so at least now she keeps a house and everything. So sometimes that tough love is hard, especially when that's your own child. That's my flesh and blood. But I had to do it. But I'm glad I did, and I see the progress she's made.
Exactly. Exactly. Sometimes doing the most loving thing is the hardest thing. Yep. That's exactly it. So, group dynamics, as applied to 12-step groups, 8 successful group characteristics. Members have shared experience. Education is the primary goal of AA. Self-help groups are self-governing, accepting responsibility, single purpose for the group. Voluntary membership, commitment to personal change, anonymity, and confidentiality. The role of sponsors in recovery. So you have sponsors in AA meetings, and there are 2 levels of sponsorship. Sponsor helps the sponsee to become or stay sober. It's another reason why, as a therapist, you may want to refer a client. Again, and it really helps cultivate connections. There is a sponsor who will basically directly help that person almost become like a mentor and mentee relationship. Counsels the sponsee through the 12 steps, guide and facilitator through a recovery process, private, consistent guidance and support. Again, private meaning one-on-one individual help getting through the 12 steps. A lot of times the sponsors will cultivate relationships that last for a lifetime. I've met many people who have had sponsors for 20 plus years, who have become really great friends, families have connected because of it. So it's a really great support system in that way. Support sponsors' own sobriety as well. So again, it's a mutual relationship that while the mentee probably immediately benefits from, so does the mentor in the long run. The 12th step is actually to give back to the community in order to stay sober. So do 12-step programs really work? Participation associated with positive outcomes. Self-selection may account for high rates of success. Very little research, though, has been done. Advantages of 12-step groups: predictability, consistency, universality, building social skills without chemicals. Again, as we talked about, one of the reasons perhaps someone uses this because they feel more confident, they feel more like themselves in a social setting, right? They call it liquid courage because when I'm at a bar, I have a drink, I am more confident talking with the opposite sex or just talking in general to my coworkers. So again, really cultivating, building those social skills, connections without chemicals. Coping skills, accessibility, economically free, which is great, multiple locations, multiple days and times, as you may find out in your experience writing the reflection papers. Disadvantages: inconsistent empirical support, again, just referring to the research, may become overly dependent, may get bad advice from other members. Again, this is one of the reasons why you want to refer a client to AA groups while still in individual therapy. There may be conflicting statements or conflicting advice, right? You may say, hey, make sure you do A, B, and C, but if the sponsor says, no, that doesn't really work, do something else instead, you have the opportunity to correct that, to talk about that, to even invite sponsors into the therapy session, which I have done. A lot of sponsors are very open to that in order to get on the same page, or to learn more. It's really beneficial. Better then versus later when they're out of therapy and then what they're hearing from a sponsor is conflicting with what they heard in treatment. Where do they go from there? Who do they believe? What do they decide? So that's one way you can weed out that disadvantage. Risks of boundary violations, structure may be lacking, lack of appropriate modeling and Christian foundation, lack of cultural sensitivity, maybe. It really depends, again, on the individual's worldview. So here are some disadvantages, but using this 12-step program as a part of treatment, going back to how you can incorporate that, just like we mentioned, how you can weed out some of the disadvantages, combined with other treatment modalities, maximizing success. Supports, counseling, help clients develop self-regulation, reduce isolation, process and reflect, generalize new skills and values. So develop self-regulation is really important because self-regulation means what?
Monitoring yourself, self-accountability.
Stability.
Stability, right, yeah, all of those. Making sure you can remain stable in really stressful situations, making sure you can use coping skills in really intense environments. That helps you self-regulate. You want to also reduce isolation because there's no such thing as a healthy hermit, right? We want to make sure that they're able to cultivate connections without using chemicals. Process and reflect, generalize new skills and values. So the role of the counselor, key to treatment outcome, encouraging outside supportive groups. You really want to encourage your clients to get connected in the community through AA groups as well as other means, because while they are craving connections and then get better and realize the importance of making those connections, the biggest connection they'll have at that point is with who? You. You are their therapist. They're probably going to establish the first healthy connection without using chemicals through you, with you. So that can become really overwhelming for a therapist because they want to do everything with you. They're going to contact you for everything. They want all your advice. They're going to, right, maybe push some boundaries. So a way you can really help redirect that without losing the momentum, because you do want them to make those connections. You don't want to discourage them from making having healthy relationships, is to get involved, connected in the community. Hey, I hear there's an A group every hour right down the street, down the corner near your house. Why don't you look into that? Or hey, what about you say you attend church, your church community? Have you reached out to anyone over there? Oh, you really like playing basketball at LA Fitness. Have you thought about maybe connecting with some of the guys over there, getting involved in a basketball group, or whatever the case might be, right? So really encouraging them to do that. Educate clients about self-help groups, let them know about the advantages and disadvantages, right? Just like we were talking about, a big part is education.
Because we have to be very sensitive because the person has to surface the phase of denial.
Yes.
Because if I go to a therapy and the person refers me to AA, I'll say, why? I'm not qualified.
Oh, yeah. So this is, you want to refer, exactly. You want to refer or refer them to AA right away.
Yeah.
Again, they would have to, they're seeing you for a reason. They would have to at least, well, again, it really depends on your clinical judgment, I should say.
Yeah.
It's going to be different for everyone. It really depends on your judgment. And very well could be the case where maybe sending them to an AA group will help them face that denial. Maybe the group will say, no, you are in denial. Take my story. Here is my story. They very well may say that and be like, listen, I lost my family, I lost my kids, I lost my job, I lost my house. I even lost myself in the process, almost committed suicide multiple times, OD multiple times. You're in denial. And maybe that's why you send them. Based on your clinical judgment, hey, maybe you're trying to let them know that they have a problem, they don't see it. Maybe it's a blind spot, or maybe they have trouble with authority, so they're not going to take your word because they doubt authority or they don't get along with authority. But if they hear it maybe from someone who can relate to their story, relate to their problem, that maybe is what breaks through their denial. But it really depends on your clinical judgment. It really does come
The
down to that.
interview of this girl was doing, she was being taken care with the therapist. And the
Okay.
therapist sent her to 12
Yes.
step. And
Yes.
when she was at 12 step,
Okay.
she was going because she was told so. But
Mhm.
while she was there, she was saying to herself, she was open up to me. This place is not for me. What am I doing here?
Yeah.
You know?
Yeah.
Yep.
Yeah,
But she, at the end, thank God, she was sent there. She's clean now.
Yeah.
You know, so it worked for her.
And really, yeah, it
You
comes
know?
down to your clinical judgment. And you
So
can have a number of
depends,
different
so
reasons for
depends.
sending or referring them. It really depends. I know, it's
But
a key phrase, and it's like, oh, it depends. Right? That's a great answer, especially when you're in court. Well, it depends.
yeah, exactly.
But it's very
It
true,
worked
because
for her.
we're dealing with really, well, one, we're dealing with
Judgment.
individuals who are individuals, right? They're not necessarily groups. They don't always fit the general rule. And on top of individuals, too, they're really complex histories, right? They have maybe a history of trauma, a history of isolation, a history of family dysfunction, a history of of maybe it's a co-occurring disorder, a history of anxiety, depression, eating disorder, who knows? It really depends. That's the key phrase. But yeah, all right, so understand potential barriers. The role of the council of referrals to groups, stay current on 12-step programs, substance and process addiction groups. Keep a list of meetings in the area. It's very simple. You go online, there are tons. Information to have. Type of addiction, transportation, desire for anonymity, background, gender, culture, religion, and then personal characteristics. Again, you just want to take basically everything into consideration when referring a client to one of these groups.
Transportation?
Yeah, so let's say you refer I had to think about this when I had literally a client in the middle of the Appalachian Trail and mountains, forest. Is there even an AA meeting there? And then once I did identify an AA meeting there, because his license is suspended and doesn't have any good relationships with his family or friends because he burned all the bridges, does he have a way? Does he have a way to actually get there? So one goal we put on this treatment plan is to contact the AA group and see if a sponsor or potential sponsor or anyone from the group would be willing to pick him up from his house. And you set that up ahead of time. Mm-hmm. So you want to make sure you take all these things and a really practical approach to it. Hey, okay, let's walk through it step by step. Once you get home, who's going to take you? Like, wait, you don't have your mom or dad because you burned bridges with them. They're not speaking to you. Your friends are not speaking to you. Your license is suspended. Your car is impounded. You don't have any money. There are no buses where you live because you live in the middle of the forest. Do you have a bike? No. Okay, well, I don't know. That's where we begin. Maybe
That's
and that's another tip. Maybe if he didn't feel comfortable, for example, being picked up by someone he didn't know, he can go on internet. Maybe there's a way
What
he
is
can.
sanita isolation?
Everything.
Right,
Yeah.
Again, you want the connection.
I know.
Exactly. And thankfully, he was very open to being picked up by a stranger, and it's a great way to meet people. So, again, making sure you take literally everything into consideration as much as possible. So, how can I learn more about groups? Consult colleagues are a valuable source. Again, when working in this field, you will have colleagues who have or are in recovery. They'll know a lot of the areas. They'll know which ones to recommend. They'll say this group sucks. Go to this group. They'll recommend that group for this person because maybe they're non-religious. They're going to be really pissed off about this group because that's all they've mentioned. If you have a Christian, maybe that group is better. Again, you can really find out a lot from your colleagues. Research, you can also just Google, call, stay current, get involved, contact organizations, go yourself. I highly recommend that. Request literature, attend various groups, complete your assignment with question papers. So that's one way you can find out about these groups. And I think it's a really valuable experience. These are useful websites. If you haven't found them yet, they're very easy to find. You basically just go on Google. Google is the answer for almost everything.
In Brazil, we have a group that's called MADA, Mulheres que Amam Demais, Women That Love Too Much.
Oh, okay.
And it became a soap opera.
Oh,
Yeah, it inspired a soap opera, and this also led people to know more about AA and
Nice.
yeah. And,
that's a good title. Woman Who Love Too Much. I like that.
Are we gonna study more?
There is a book.
Before the semester's over?
What's that?
women
Are we
that
gonna
love
study
too
more
much.
this book before the semester's
Mine.
over?
I have to double check the syllabus. I think there are a few more chapters. Yeah. All right. So questions about 12-step groups before we talk about our quiz next week.
What's the chapters again?
9 and 10.
9 and 10?
Correct.
9 and 10.
So before we talk about the quiz, how many people have at least attended one group so far? Oh, okay. All right, okay. So the great part is you still have over a month to attend. What's that?
So I've been attending group for 3 semesters now.
Hey.
Because every class I'm taking is asking me to go to a group.
I'll go to a
so I
group.
stay.
There you go. Yeah, exactly. So again, there are plenty, and if you have any trouble identifying any groups, please let me know. It really, hopefully isn't too hard for any of you there. I know at Nala, South Florida, there are tons. I think there are like literally 60 within Deerfield Beach. There are tons.
60?
60, yeah.
Well, being
A
new
lot.
here, I wasn't,
At least according to Google.
I wasn't that familiar, but I went to a couple, but he told me and she told me, they told me to call, but they didn't, they told me to go to them. So
Yeah, I
had to
guess.
sign. So
Honestly,
I'm just gonna go.
yeah, you might find, if you are having trouble finding any, which I highly doubt,
I found
look
one.
between here and Delray, where that's known as the recovery
I
capital.
found one right here in
Yeah.
Atlantic.
Recovery capital.
Yeah.
Pompano,
That's
Atlantic,
hilarious.
they have the same one he talking about. I
Yeah.
just, and the times like Monday, Friday, I
Okay,
do like they said, I'm just gonna walk in there.
okay.
I'm like,
Yep.
so I need to
Yeah.
get up, so I'm just gonna
Yeah.
walk in there Friday. I'm just gonna look pretty, have my little skirt, and they're gonna be like, what you doing here? Yeah, for-
Do you know of any all unknown in the, here?
I haven't looked up any, but I think there are tons.
Yeah, I'm
I think
gonna
there are
check.
all the groups we mentioned today, there are tons of them. Luckily, we are in a really advantageous spot because South Florida, again, as mentioned, is the recovery capital of the world. There are, I think, about like 20 treatment facilities in like Delray Beach alone. So
So that would be a job for us,
there are
right?
a lot. Yeah, no, it's a great job market for therapists. No, honestly, a lot of therapists end up moving down here to work in substance abuse. One of the therapists I worked in Northern Virginia, middle of like mountains, I heard about actually the place I interned because he specialized in substance abuse treatment and knows Delray Beach, Boca Raton, West Palm Beach very well. Lake Worth, Fort Lauderdale, all that.
There's in the radio, they talk about to have about 18 years old without drink. They have like 2018. Now they have 80% the people who went to the treatment and clean. Now they want 100% the 18 years old. without drink.
Okay,
On
wow.
the radio, they have
Okay,
counseling. Yeah, Christian radio.
wow. Okay,
It's a
so
lot.
quiz 5 we have next week is going to be in class. It will cover chapters 9 and 10. It's not going to cover chapter 12. Again, what we discussed with the 12 steps is just simply for your knowledge. Hopefully it helps clear up any of your questions if you had any. And it's only, I'm going to cover those 2 chapters.
True and false, 100 questions.
Oh,
We'll see.
Don't do that.
Short answers, please.
no.
They'll be very similar to how they have
End of
been.
semester.
Very similar.
End of the year.
Yeah.
Not end of the life, but almost.
I don't know if the year is ending or my life is ending.
I should have your papers that you handed in last week ready
Yeah.
for you next week. Your grades should be posted up by before actually we meet next Wednesday. Okay? You're welcome. Again, if you have any questions, please feel free to contact me.
I'm gonna send you email about the classes.
Yes, please do. Okay? On that note, we're out a little early tonight.
Yay!
And if you look on your pocket light, this video will be there for you, so please feel free to reference it.
Which video?